Good morning. My name is Sam Bryant, and I serve as a president of the Senate and a senator for the School of Public and International Affairs. I oversee the 48 other senators and 6 staff members. I was chair of the Campus Safety Committee last year, which prioritizes the importance of student safety on campus, including, but not limited to, lighting, police visibility and response times, and safety incidents on campus. Based on student demands, the Senate has compiled a summer town hall series where we are bringing administrators together to answer the questions students and parents are asking. Today, I am so excited to have our first guest with us for the University Health Center. Dr. Garth Russo, will you please introduce yourself as well as give us an overview of the University Health Center?
All right. Hi, everybody. Garth Russo. I've been at the Health Center now for, I guess I'm going into my 29th year. Started back in the old building up on North Campus, the Gilbert building. And have worked myself from staff physician to the executive director over the course of the last 3 years. That's been my role. The Health Center is one of the larger ambulatory care centers in the state, and it has a fairly diverse footprint in terms of the services that it offers. So the core services are those primary care services that you would think of in terms of traditional medical services. So routine health care, physical exam, ill care occur in 4 primary care teams that are colored gold, blue, green, and red. The red clinic also serves as a sports medicine specialty service area, and those providers serve the athlete population's primary care needs as well. Athletics has fair extra health related services that they support, but we coordinate that through the team physician structure that we offer there. In addition to that, we call women's health out of the primary care, and so there's a dedicated clinic for women's health services. They do pretty much the full range of women's health outside of obstetrics. There are counseling and psychiatric services that fit under the umbrella of what we call CAPS. CAPS has embedded some behavior care managers into our primary care teams. So there are 3 extended service lines that basically coexist in the primary care clinics that are available for issues that surface kind of in real time, and or we're not really sure that they need CAP services, but they have needs and we can help sort out what those are. Those people also help support extending the psychiatrists with medication management. So they act as a liaison between the primary care providers and a psychiatrist who acts as a collaborative care resource for the providers in terms of deciding whether medicines are working, whether they should be changed, that sort of thing. That's been in progress now for about the last 3 years. I've been fully staffed for fully 18 months and has been extremely well received. It's really helped balance the access to CAP problems that we've had in the past and that occur all over the country. We do have a very robust health promotion department. They range in services from nutrition to alcohol counseling. They house our RSVP advocates and our respondent support program. And we also have a satellite area for collegiate recovery for students who are sober. We have extended services through physical therapy, massage therapy. We have a dental clinic. We have a vision clinic that's pretty much full service. Pharmacy, radiology, ultrasound, lab, all kind of help support the services that we provide. That's all under one roof. There's a whole host of other things that people don't see that requires services. So it's a very robust support staff who help keep the environment clean and safe that we would not be able to survive without. And there's a lot of administrative support and making sure all those disparate parts work smoothly together. So that's the Health Center. Very proud of it. Very proud of the services that are there and the consistency of services across all the department lines.
Yeah. Well, great. Yeah, thank you. And I think it's kind of interesting that you started your UHC career in Gilbert. I started my academic career in Gilbert with a Spanish class. So
oh, that's too cool. That's too cool.
It's kind of funny. I was I found it super interesting when I learned that it was a health center because of the like the snake around the little staff
Yeah,
and
the
everything. But yeah,
caduceus, right?
yeah, yes, sir. But yeah, thank you so much. So we'll go now and jump into a few questions. And
Okay.
you mentioned some of the services that you offer. How has the pandemic affected services and resources within your department, and how differently will they look in the fall?
Yeah, they'll be different, and it's been fairly dramatic, the overall impact.
Mhm.
We never really shut services down, although students being absent from campus and everybody, kind of under home advice, that limited what we could do, mostly to telehealth related services. And we had previously, coming into the pandemic, a plan to, over the course of the next 2 years, learn, gear up, and eventually have a fairly robust telehealth service. And so during that time, from March until April, we basically, hit the deck running and created that program in 2 months, and when we thought it would be 2 years. So a lot of learning. Fortunately, our electronic record had the capacity to support Zoom-based encounters. Um, we just had no experience with it. And I think probably all of us are much more facile with Zoom now than we were in January. Um, so it was actually kind of good for us to be single-minded in terms of the service line. So it's all we could do pretty much. We did have some, COVID-related care and testing and that sort of thing that we did through the month of March and April. But it really hasn't been until, I guess, June that we've really began to ramp up on-site services. If you weren't here, there were 5 tents set up, 6 actually, but 5 big tents set up out in the parking lot. We pretty much moved all our services outside so that we didn't have to worry about the safety inside. Since the heat has come, we've pretty much reduced that. We have 2 tents, but we're not actually using them. We're just holding them in case we need to move some service outside. So working outside, shifting to virtualized care has been kind of the history of the last few months. And now we're trying to settle back into what the future will look like, which is what everybody, watching is interested in. And that will be a blend of telehealth services and on-site care. We've turned off web booking and tried to limit walk-in services so that we can manage just the flow of individuals coming in, make sure that they're safe. We do a telehealth visit for folks who are sick with respiratory illness, and arrange in a coordinated way for them to get tested if that's what's decided. We do testing on site, and then depending upon the relative symptom complex, we'll either then make a physical visit with them, or if really the issue is you're not that sick, but we need to know what you have, then we'll basically let the testing be the experience on site, and the telehealth experience be the care provision part. If a person's particularly ill, then they get physically seen. Other clinics are doing similarly with well care, although if it's not an illness, those folks are actually the people who are coming in for more traditional face-to-face visits. And essentially every service line has that blended capacity. So even Vision has telehealth capacity. Our women's health actually has become quite robust and facile with its telehealth capacity. And anybody that we can take good care of without them having to maybe even leave the safety of their own home, travel with public transport, if we can avoid that and deliver the same quality, then we're happy with that. And I think most folks have been quite happy with the ability to have that service. The pharmacy, turns out we learned a lot about our pharmacy being probably the highest volume attractant to people. So people need their medicines. We didn't have mailing capacity, so pharmacy developed curbside pickup for medication refills, and they'll keep a blended capacity of that and in pharmacy services for themselves. Dental clinic has probably been hit the hardest in that procedures require some fairly sophisticated preventive measures. You're aerosolizing when you use a drill. And so we're testing people who need procedures before the procedure, just like a hospital is for their procedures. And we had to purchase some special equipment, suction equipment, to make sure that the aerosolizing is minimized to eliminated. But like I said, every service line, even physical therapy, is now back in a blended experience with their physical and telehealth capacity. Everything is slower. When you're cautious, it's slower. Everything's more costly. It's true that acquiring personal protective equipment has been challenging. We were very fortunate in that we had a fairly robust store of like N95 masks in specific going in, and so we've really not completely depleted that. And we do have the capacity to reuse we can sterilize and then reuse lightly soiled or non-soiled N95 masks. So there are two ways that you can actually recycle those materials. So business as usual. No, a lot of queuing in and out differently than before. The look of the health center is very different in terms of the types of sanitation equipment that's everywhere, and the stanchions that are designed to keep folks from crossing paths. But in general, the service line is all there, and the capacity is probably just a little bit blunted by some of the the inefficiencies of being efficient. So yeah, and we anticipate putting back up online access to appointments. Right now, we're working with the logic of how do you commingle access to a telehealth visit versus a physical visit. When there's some fairly complicated logic that could get into that, but I think by the time we open for classes, we'll have pretty much the overall way of interfacing with the health center will be the same. Just the option list will be a little different.
Okay, cool.
Mm-hmm.
And so you mentioned like some of the new adaptations you're having to do with the services, like the telehealth and outdoor sites and the curbside pickup at the pharmacy. Are there any other like specific programs or events that your department is planning to host in the fall?
Yeah, I think, I don't know if last year you were involved, but a lot of SGA was involved in the Fresh Check Day, which we think and still think is really the right way to start, residential learning. Of course, that requires, it's basically based on face-to-face encounters with peers. It's hard to orchestrate and not knowing exactly what the conditions were going to be in August. Back in, I think, April, it kind of became clear that we were going to have to move that to a virtual format. So the little booths that were associated with the Fresh Check have all been put into virtual sessions, and we'll offer those this year in August as people return, as kind of a compromise. But the content is still there. It's just not the experiential piece that we want it to be. We've talked about perhaps we can do that, a fresh recheck day in January. But I think probably realistically, we're looking at probably next fall to have that back as a physical, experience. Totally committed to it, but that's not new programming, but different form of programming than one would have expected. Essentially all of our outreach that occurs either through CAPS or the bulk of that's actually done through health promotion. All of those face-to-face, small group, tabling type activities have been also virtualized. So now the whole palette of programming can be accessed and enjoyed, experienced through more virtual means. There are several new videos that have been put together by a lot of the CAP staff that are accessible. All that's under the umbrella of our Be Well program, and the new framing for health promotion is You Matter. So there's a new program line, You Matter, and all the Be Well programming. It's virtualized. We're not sure. We typically have a kickoff day. We typically have International Day when the international students come back. those programs are, kind of hampered by size. And so we're basically going to kind of on the fly figure out how to cover the activities that occur during those times once we get a handle on how little or how much chaos there is at the beginning of the year.
Mhm. All right, cool. And I'm super excited that you mentioned like Fresh Check, because I know like Fresh Check is a really important thing for like not only SGA, but just university. And like Fresh Check is a fun day event, and for viewers watching, with like interactive booths, free food, and prizes to learn, all about like what a UHC has to offer. So I think it's great that students, and particularly first years, like you're saying, will be able to have this through an online forum and continue to be able to see those services and become more comfortable.
Now, we have a lot of partners who join up with that. It'd be very remiss to not include
Mhm.
Office of Emergency Preparedness and
Yes.
the Ramsey. There's just a whole host of folks who use that platform to try and introduce their supportive services for students. There is a new module. We have a module for violence, and we have a module for alcohol. There's a new mindfulness module that students take as they enter that we partnered with the president to acquire. The president's been very supportive of us improving our mental health delivery service line and the range of services that we can offer there. So that's that module we used support from the president to acquire for this year. We're hoping to make that a system-wide offering. It's new, it's got a little bit of kinks in it, but overall the intent I think will be there. And we last year were approved to be able to use some funding to acquire a therapy assisted online piece of software, which has a wide range. We will open that this fall with just passive content, so knowledge base around mental health and stress related issues, some self-help modules that people can work through for stress management, time management. We ultimately will start to include that in our care plans for our therapists, and then ultimately there is a blended telehealth physical encounter service that can be platformed through TAL. So while right now essentially all our CAP services are being done through telebehavioral health, that's all just face-to-face like this. To have content modules and a dashboard to help somebody progress through a care plan, we think that's really a very positive addition, and that too is here with some of the support of the president.
All right, great, yeah. And now one of the other things that students and like parents have been like, wanting to know, like have questions about, is the application of like guidelines from like states and like federal departments and agencies. And how UGA is applying those. So how are decisions being made based on like CDC guidelines and Georgia Department of Public Health?
Right. Well, first of all, the CDC guidelines pretty much are the guidelines that come out that are kind of official, and everything we would do would have to meet muster relative to them. Now, the way that gets down to the college level is the system USG has partnered with the Georgia DPH, and in conjunction with the Georgia DPH has offered some guidance to each of the 26 institutions. Each institution, UGA being the flagship, has taken those guidances around instruction, health and safety, and put together basically a reopening plan using staff who are most familiar with UGA and the landscape at UGA, and incorporating into daily work how do we build in social distancing? How do we provide for hand washing? How do we identify an individual who's sick and needs to be isolated or quarantined? All those questions. How do we clean an environment? How frequently? What materials do we have to use? How do you transport people and keep them safe? Dining, anything you can think of, has kind of been looked at relative to the guidances that have been put out, and fortunately been put out specific to each of those areas. So there is Institute of Higher Education guidance from the CDC and interpretation of that through the DPH that we've all been using to say, well, how does this fit here? And then saying what we think's best and feeding that back through the president to the system to get approval. So that kind of closed loop form of communication and planning has been going on pretty much since late March, early April. Plans were put forward in May, very early June, and we've been phasing our way into. If we said what we thought was right, now we've got to make it be. So we've been kind of scurrying about putting all those kind of recommendations into practice. And in doing that, there's been a relatively iterative process about what is the best. There's been some changes in some of the major guidances around, let's say, isolation just changed last week. So being flexible and on the fly, kind of adapting what we have, what we projected to what actually is there now, has been fairly active. Now we have had a couple of subgroups around health and safety. There's a preventive services advisory board now that exists, and there's a medical oversight task force. Both of those entities are kind of the smaller live groups that can just take a question, handle it, move forward, or who are working on some of the more larger projects that needed to be in place, like testing and some sort of notification schema. That notification schema would ultimately help inform the Department of Public Health, which our district is going to be responsible for doing the contact tracing on campus and in the community. So we have a very tight relationship with them right now, building that structure.
Okay, great. And real quick, I want to thank you so much for the work that you've been doing and your department's been doing, because I know this has not been an easy challenge, and so I know SGA thanks you and your department for your dedication for students' health, whether it's in a regular day on the UGA campus or whether it's amidst a global pandemic. So thank you.
That's back at you too, because like I said, I know it's the truth. Coming in this morning, I'm more nervous talking with you guys than I am with the president. Well, and you need to know it's important. You guys are why we exist. And for there to be organization within the student body that's as tight and invested and engaged and accurate in its insights as to what is realistic and where the priorities need to be, that's a special asset. So you get my kudos for that.
Well, thank you. And another big question that lots of people have is, what happens if a student thinks they were exposed or experiencing symptoms? Can they get tested at the UHC, which you've touched on a little bit, and will they need insurance?
Yeah, those are great questions, because you kind of multiply that by 36 or 50,000, it starts to get kind of complicated. But the first thing I will say is we really need to appreciate that there really isn't any stigma with being sick. And there's, that I think we worry most about, someone who may be afraid that somehow that could come back at them in a negative way, but it's the complete opposite. I mean, we all really are a community, and us, the best way we can show respect for the community and vice versa is for us to be respectful of, I think I could cause harm to somebody else, and by no means should you be held in any way in a negative framework around doing what you need to do to protect others around you. Fortunately, most of the students aren't being that sick, and there have been several who've gotten sick with COVID. So it really is that behavior around being sick isn't so much therapeutic as it is social. And it's not to take away from the fact that people can get quite sick, but fortunately, when you look at the numbers scaling, it really is, if we all understand that it's okay for us to not go to work or school today. That's my primary message, I would say. But if a person feels sick, we will be screening or asking folks to screen every day. If they feel sick, the first thing is to stay at home. If they suspect that they've been exposed or have active symptoms that are associated with COVID, there's kind of two strategies for that. Symptomatic individuals, they should get tested. as best we can. And there's ways to empirically manage that, but we really want to know. And so for that, the health center is the site for students to seek out care. The community is the site for staff and faculty to seek out care. They have their providers. We wouldn't want to try and create a parallel process for that. For those who are told, I just got diagnosed with COVID, and we were basically out, playing frisbee yesterday, and I think we came a little too close together. Maybe you're exposed. That person, self-quarantining when you feel like you've been at closely exposed or contact, that's the path of that individual. If you're not sick and you've just been exposed, then it's a little different than having symptoms. So if you're not sick and you've been exposed, then really you have to wait for the full incubating period to pass before you can say you're out of the woods. I mean, there really isn't a test strategy to indicate where you are in that quarantining. So quarantine's put out there as a 14-day time frame, because at any time in that 14 days you could start to get sick, and it's not until after the 14th day that in all statistics would say you're not going to get sick, at least from that exposure. So if you test yourself on day 1, 2, 3, 4, it doesn't mean anything about day 5, 6, 7, 8. And so most would say if you're going to test in a quarantine situation, you really should wait to that 10 to 14 day mark to do that, or if you get symptomatic during the time frame. So just hunkering down is kind of the case for the closely contacted. And that's where the biggest impact on campus can be. If there's a lot of close contacts and a lot of people quarantining, then you're really moving people offline in a way that we'd rather not have to do. So it goes all the way back to that. The more you social distance, the more you wear a mask when you could be in contact with others, the more you do good with your hygiene, the less likely you will fit the definition for close contact. And then you are controlling your ultimate destiny as to whether you're ended up in quarantine or not.
Mm-hmm. Okay.
We would provide care for students with symptoms. We would do testing for students with symptoms that they can get tested anywhere else if they would like to get tested. But we see that as our responsibility. And there will be some asymptomatic testing on campus as well, that students will be encouraged if they just want to get tested. That's kind of the way to do that. Same thing for faculty and staff. That, in our mind, helps us surveil the community, but it also helps us keep people who are not ill out of clinical spaces so that we can provide clinical care in clinical spaces to the people who need it most.
Okay, great. And just to clarify, so students will be able to have that access even without insurance?
Yeah, insurance right now, insurance is covering all COVID services. There are some kinds of tests that insurance exclude from that, but the diagnostic tests that we use, insurances have to pay that. And in the health center, COVID-related care, insurances are paying that. Well, we don't, if your fee's paid, pass that on to you as far as what you might owe as a student. There are federal funds available for the uninsured, that for both testing and for services delivered in traditional care in a primary care setting, those get reimbursed. And so we would try to get funding from that. If we didn't, we'd write it off. But there should be no cost for COVID-related services at the health center.
Okay,
that
great.
should be the case kind of everywhere. But you walk into a clinic and you get a different kind of test, an antibody test maybe. Some of those tests insurances are excluding.
Mm-hmm. Okay. And so you mentioned briefly the student health fee. So can you give more information to the students, parents watching, about can you give more information on what the student health fee is?
Right.
And where it's going?
Right. Yeah, and back in the day when I was at Gilbert, that's all there was a health fee, and we didn't charge anything for anything. And then over time, the economic platform for the fee couldn't keep pace with the true cost of delivering services. And so now we've evolved to a blended model where essentially 50% of our services, it's a couple percentages above and below, but basically it's 50-50 fees from students and 50% services that we charge for. Many of those services are peripheral to the core delivery of primary care. So revenue from the pharmacy, for let's say, where faculty and staff are actually able to use the pharmacy, or the vision clinic, where faculty and staff are able to use the vision clinic. Those revenues help us keep the whole health center afloat. So those are not business entities in and of themselves. The pharmacy isn't. The health center is the business entity that benefits from any revenue that comes in. So there is this hybridized experience where core services, mostly if you think primary care, those are contained within the umbrella of the, of the health fee. And we try to bill for services outside of that without incurring anything that rolls over to the student through insurances. So we do try to make as much revenue as we can through our primary care services while holding the student free of incurring significant debt from those because they are fees paid. But there's fees to come in, so it's not absolutely free, but it's designed to be as minimally impactful to cost to the student for routine care. Dental services are a little different. Vision services are a little different. Physical therapy services are a little different. But for the most part, those core health care services are designed to be as low cost to the student as possible. And then it's a matter of just balancing a budget every year. And any growth that occurs that isn't revenue generating, we have to look to revenue generation in another area or request fee increases to try and cover those. And those pretty much have been, and I would project will be, only to try to create a more robust mental health delivery services. They don't get reimbursed, the way they otherwise would through a regular medical model. They should. There are many people who do not have, or if cost were a significant issue in accessing counseling, they would not access that as freely as they might ought to should, because of just awareness of others in terms of the services that they're accessing. So we try to let that be subsidized by the greater health center revenue or through fees as best we can. So it's just not as got a profile.
Okay, thank you.
Right, and the campus community is there. I know for myself, I know all the people in student affairs across academic departments that I've had a chance to interact with of late that I don't typically get a chance to. They are poised and ready to help people work through those challenges. So you're not alone.
Yeah, yes, sir. The solidarity of Bulldog Nation.
There you go. Dog strong.
Yes, sir. But Dr. Russo, thank you so much for taking the time to speak with us today.
You're very welcome.
We're very thankful to have your leadership here at UGA UHC. And we invite all parents and students to go visit uhs.uga.edu to learn more about our health center.
Yeah, that's the best site. That and the COVID website for the university. There's been a lot of good work there.
Mm-hmm. Yeah. All right. Our second guest for today is from Emergency Preparedness, Mr. Steve Harris. Mr. Harris, will you please introduce yourself as well as give a brief description on what emergency preparedness does and how it serves the university?
Yeah, thanks, Sam. Thanks again for the opportunity to be here. Appreciate it. And thanks for what you guys are doing with these sessions. Again, my name is Steve Harris. I'm the director of the Office of Emergency Preparedness and Insurance and Claims here on campus. So our office does a lot of coordination and managing from things from UGA Alert, the emergency notification system on campus, to building emergency plans, to business continuity plans, to defibrillators, to bleeding control kits, variety of things. We do a lot of training from active shooter response to basic emergency preparedness. We run the gamut of doing a lot of things. Obviously, our mission has changed a little bit since pandemic began, but we still do those things and deal with a lot of different coronavirus issues too as well.
Mm-hmm. Yeah, great. And thank you so much for joining us today.
Absolutely.
So you touched on this a little bit briefly on your intro, but can you tell us what all the different types of services that your department offers and the resources available on your website?
Sure, absolutely. So a couple of things that may be of interest, particularly to students that we do, is we have, well, a couple of things. We coordinate our Live Safe mobile safety app, which is an app that's free for students. Now, I know students have a ton of different apps, but this is a good one. This one's unique to UGA and it's great. So it provides a lot of safety and security functions on it, from knowing where all of our AEDs or medical units, defibrillators are, and bleeding control kits in every building on campus, to also providing you with information and maps of campus. It can help you take a safe walk. So if a student wanted to walk across campus late at night and didn't have a friend to walk with, and maybe they didn't feel comfortable, this app will allow you to connect with another student that doesn't have to have the app. And the other student is able to see them on a Google map and where they're going. If they don't make it in a prescribed amount of time, it'll chirp that other student to check on that person to make sure they're okay. So the app has a lot of really good resources and features and emergency plan stuff on it. And again, it's a free download. One of the other big things is emergency alerting is a big thing for us. And we do that through a variety of modalities. UGA Alert is kind of our main method of getting information out to students. And so what we always ask students to, particularly in orientation, and of course, due to COVID this year, a lot of our sessions didn't occur in person. But what we ask students to do, and we encourage them to go into UGA Alert at ugalert.uga.edu, that's the website. They would use their MyID to access it, and then make sure that their information is accurate and correct in the system. So students can receive an emergency alert in a lot of different ways. They can get a phone call, they can get a text message, they can get an email, and they could get, use multiple devices. They could get a desktop alert. But basic information is transferred into the system from that student's record. So students really need to check that, because they don't automatically get a text message, which incidentally is one of the fastest ways to receive the alert. So they want to make sure that they select that they would like a text message, or maybe add in another email address or a phone number if they prefer. We only utilize that system during, big campus-wide emergencies that impact everyone and require immediate action. So it'd be like a tornado warning. It'd be like God forbid, any kind of shooting incident. Those are rare situations and things like that. So that's when we use that system. We have some volunteer groups that are good non-academic credit for students that are really good. One's a campus emergency response team, CERT. Now, a lot of the communities back where students come from have CERT teams that are managed by fire departments and emergency management. So we have one on campus for faculty, staff, and students. Lots of good training opportunities, getting free CPR course, free AED course, learn more about disaster psychology, learn more about a lot of different things relative to emergencies. Also, we have one called the Medical Reserve Corps. And this one is used to be federally funded through grants, but now there's not as much grant funding out there, but we've been able to support it. This one, you don't have to be medically inclined or in a medical major or minor, but this one works with, a lot of our community partners, including public health, to, market flu shots or assist, like right now, assisting with helping out public health with certain things due to the coronavirus. So these are great opportunities. We have a lot of good participation. And we also have another one called Student Ambassadors, and you have to apply for that. That's kind of our liaisons from our office that work all around campus through Greek organizations, through SGA, through a lot of other organizations, to have that peer-to-peer contact with students. And once they learn through our office what we do and how they can be better prepared for emergencies, these students go out and are good ambassadors for our office and go out and engage other students. And actually, we let them, once we feel comfortable, they'll teach some of our classes too to assist us. Because as we hate to admit, I'm not 18 through 22 anymore, so I know that students sometimes like to hear from their peers. And so we find these good ambassadors to help us out with the office. So a lot of different things. Our tagline is emergency preparedness is everyone's responsibility. So we like to make sure we convey that, particularly to new students that are coming onto campus, to make them know that this is a partnership. We're providing a lot of good things like an alert system, medical devices in buildings like an AED or bleed kit, good lighting on campus. We have a really good police department that patrols very well on campus and is very good in assisting faculty, staff, and students. But there are things that students need to do too, as far as making good choices, not walking alone at night, just doing a lot of good things that help keep them being situationally aware of things, knowing a couple of exits out of a building as opposed to one in case there's a fire. It's a lot of things that they can do to help themselves and help us as well.
Yes, sir. Yeah, I think that really speaks to like the need for like our community to come up and like step up together and like represent one another as bulldogs.
Absolutely.
Like that.
Sure.
I think thank you for like mentioning that. And now I know like with COVID-19 and with a pandemic like this, I know EP has had to like play a role. So like, how has EP responded to the ongoing pandemic and the transition back to campus?
Sure, it's a great question. So we're kind of the keeper and the coordinator of the campus. Originally, it was an influenza plan because we were planning for back, it's been 10 or 12 years ago. It was H1N1 or the swine flu. So we had plans for that. This was a little bit different. So that was a good format or a good structure to respond to this one. So we have been working really hard with a lot of faculty staff on campus to coordinate different meetings and planning meetings and conference calls to make sure everyone is coordinating well. We've reach out to our local and our state and federal partners to make sure we're connected and we're all working together for the same end result. We've had a different kind of unique role. We do a lot of coordination of PPE, which is personal protective equipment like masks and gowns and things like that. The College of Engineering this year, back in the spring, and the UGA Instrument Lab and Lab of Archaeology and the library started making face shields, which are devices that were really hard to get, clear plastic shields to help our first responders and our healthcare professionals. So we were kind of the group where they could request those, and those were great entities that put those together, and we helped coordinate that and get them out to our hospitals and other groups on campus and other places that needed that, as well as help pull together PPE for the Georgia Emergency Management Agency early on in this pandemic to go out to those healthcare providers that needed it. So those were coordinated with other groups on campus that may have had excess. Other things more recently that we've helped with are faculty staff modules, supervisor modules. These are training modules that have been put together to provide faculty staff, and there's a student module coming out too that we've assisted a little bit with, but we haven't been the point person on that, to help faculty staff understand their role and creating that safe and healthy university community and working together and understanding COVID a little bit better and understanding how cleaning and disinfecting are working on campus and a lot of different other safeguards and what's being put in place. So doing those and some other guidelines that we've been working on. So it's been really busy. We've been working the whole time and in person. Mm-hmm. So yeah, it hasn't stopped our normal duties as well as this. But I mean, it's a challenge, but I think all of our folks, and I've been really impressed with all the university, with faculty and staff that have put together some really good reopening plans for a variety of scenarios. So I think we're getting where we need to be.
Yeah, that's great. And we really appreciate all the work you're doing to help students. And I know
It's a team effort. It's a team effort. It's a lot of different people across campus that are doing a really good job.
Oh, yes, sir. And you mentioned how educating students is one of the big pieces of what you all want to do over at EP. So what recommendations do you have on how students can best prepare for emergencies while on campus?
Just general emergencies. Yeah, I mean, a couple of things that I mentioned earlier, downloading the LiveSafe app, making sure your information's accurate. Take a volunteer course, like I mentioned, or take a CPR or bleeding control course such that you could help others during an emergency. I think it's really good. I know people worry about liability and things, but you provided some really good protections under Georgia's Good Samaritan law. Develop an emergency kit for your residence hall room or your apartment or vehicle that includes flashlight, extra batteries, some water, some non-perishable food items, just some things that you think you might need if the power were to go out for a short period or extended period of time, or you were to get stranded in your vehicle. Just try to think about emergencies before they happen and what could impact you, and try to prepare for them a little bit better so that you're not in a bad place when they actually do happen.
Mm-hmm. Yes, sir. And then Like going off of that, what are other precautions that should be taken for the safety and well-being of students?
Yeah, so let's shift kind of to the current pandemic that we're in. Yeah. So, you know, the university and the university system of Georgia are requiring face coverings,
Mm-hmm.
and the university has been really good in providing students two face coverings and a thermometer. So the idea there is also that students perform a symptom check in the morning. It's a requirement before they come to class, or if they're student work or go to work or whatever, to make sure that they're, for lack of a better term, fit for duty for the day. They don't have 104 or greater temperature, they're feeling well, those kind of things. Practice social distancing. I know that we're all social folks, and you know, and that's part of, you know, the academic and social growth in college. But we have to take a moment to think about our community and our individual responsibility to others. I think you mentioned that early on. We need to be cautious. We may need to take a pause in some of our social activities and reflect that, hey, we need to keep that distance. Maybe some things that we were going to do, we need to think about that a little bit better, such that, you know, we can protect ourselves, protect others in the university community, faculty and staff, and also protect our parents and grandparents, you know, by wearing that mask, doing those social distancing things, conducting those daily self-monitoring, those checks. Hey, if you get sick, don't go to class, don't go to work, and check in with your professor, check in with your work. You know, it used to be a badge of courage when people, I say this used to be, when everyone would go to work. Oh, wow, Steve's here sick today. He's really a hard charger. He's working today. No, we don't want you here if you're sick, because then you're going to get me sick, my kid's sick, my wife's sick, whatever. So yeah, I mean, it's just kind of a different way of thinking. So I would expect and hope that students, and I know they will for the most part, be good models and ambassadors for good social distancing, wearing those required face coverings, and doing the right thing and being a good student leader on campus and also in the community too as well. I think that's the expectation of being a good dog in the community as well.
Yes, sir. And you keep hitting on it, and I wholeheartedly agree. Just like the accountability to one another, students to students, faculty to students, staff to students, faculty to staff, all over, and community, just to keep Athens, Clark County safe. But continuing on, and you've hit on these before a little bit, but what's like the best place for students to stay updated and learn more about the services you offer?
Yeah, probably the best place, and that's a great question, is our website, and that's prepare.uga.edu, prepare.uga.edu. And then, you know, if we were to have, in the event we were to issue a UGA alert, and were to include additional information, there's another website, emergency.uga.edu, that would more information would be posted about that particular emergency. So those are two good things to know about, particularly the emergency preparedness website. For coronavirus information, UGA maintains a coronavirus webpage, which is jam-packed full of great information for faculty, staff, and students on a variety of topics that students and faculty and staff may need to know too. And that's coronavirus.uga.edu, and it was recently updated with new information, a fresher look, so it looks great and provides it's chock full of great information.
Yeah, that's great. And students, let's really check that out, parents as well. One of the big goals for this town hall series was, in our survey data we got, lots of students wanted to be able to hear from administrators and stuff like that. And so we really expect lots of first years to be tuning in and hearing what all you all have to say. And so going off of that, what's some advice you would give to incoming students during this time?
And I thought about that, and I was trying to think of the best response for that. I would say be patient, be flexible, and kind of practice individual responsibility. To go back on that, I think I mentioned that, you know, we're probably tired of hearing that this is an unprecedented time, but it really is for everybody, not just for the Bulldog Nation, but for our state, for our nation, for the world, for that matter. Guidelines, recommendations, all kinds of things are constantly changing, and it can get frustrating. So one thing we're telling you today may change tomorrow just because we have better research or we have better guidance or whatever. So I would just suggest to students just to be very patient, very flexible in the way that we do things. and just practice that individual responsibility. This another cliche is we are entered in uncharted territory when we go this semester. So there will be some changes. There will be some unique things as we all go in with our mask on, and practicing social distancing. There'll be, plexiglass barriers in the classroom. There'll be reduced class sizes. So, this will be very unique. And I kind of feel sorry for those first year students. They're not getting that full experience. I mean, I don't think we know at this point about athletics or in some of the other things like that. So, we're standing by for that. But I just would say that the main crux of it is being patient and flexible. Those are important things to do.
Yeah, and I think those are great advice and wise words for our first years, because I know it's been a struggle for many people. But we just, stay focused, pay attention, and learn as this goes through. We can all hang in there together.
Absolutely.
But so I want to end a little positive note.
Yeah.
But so what are you most looking forward to in the fall?
Sam, I am looking forward to somewhat of a routine. I'm looking forward to getting our students and faculty and staff back on campus. I miss that. It's been very desolate air on campus all summer. So I miss that activity, but we want to do it in a safe and healthy manner too. So again, we want everybody to come back, and that's what's happening in person learning, but we want it to happen in a safe and healthy way. So I am, totally looking forward to getting back to whatever that new normal is, fall semester, and welcoming those new students and welcoming the, returning students and our faculty and staff. I'm really looking forward to that and seeing everyone back on campus.
Yeah. And I would say I agree with you. I am looking forward to it too. No matter what it holds, I think it's going to be a lot of challenges, but I think it's a great time for us to be able to come together and grow, and hopefully things work out. But Mr. Harris, Steve, thank you so much for taking the time to speak with me today, to speak to these students and parents. And we invite all the parents, students here listening to visit prepare.uga.edu, like Steve has mentioned to us, and to learn more about emergency preparedness and how we can all work to make Bulldog Nation a safer place.
Sam, thanks so much for the opportunity. Thanks for doing this, and I hope that you have a great year.
Well, thank you.
Good afternoon. My name is Will Curvin, and I serve as the chair of the Committee on Campus Safety, and I also serve as a senator for the Franklin College of Arts and Sciences. Our third and final guest of the afternoon is from Student Care and Outreach, a department within Student Affairs, Dr. Carrie Smith. Dr. Smith, would you please introduce yourself as well as the amazing role that Student Care and Outreach plays on our campus by serving our students?
Sure, thank you for having me. So I serve as our Assistant Dean of Students here in Student Care and Outreach. Student Care and Outreach, and my role specifically here, is to oversee our non-clinical case management services, which of course doesn't really mean anything outside of higher ed jargon. But essentially what we do is provide support and assistance to students regardless of what their circumstances here are at UGA. The idea is that everything is individualized. We don't have flow charts. We don't say if this, then that. Our role is to hear what your story is and figure out how we harness campus and community resources to make sure that you can reach your goals however you define them. So sometimes we say we do little C counseling and little A advising, whereas we have big A advisors and big A counselors on campus. So we're kind of your person or your resource for resources here at UGA.
Wonderful. Well, thank you so much for that. Well, if it's all right with you, we're going to go ahead and jump into some questions submitted to us from our students and parents.
Sure.
Awesome. So first off, how has the OSC changed during this transition, and what will look different this upcoming fall?
So Student Care and Outreach, and we're asked this a lot, I don't think that we've really changed in terms of our services that we're providing. So like I mentioned, the whole idea is to figure out where students are at that very moment and then connect with them both on a personal level, but also in terms of the resources and support systems that are available here at UGA. So the idea is that really all that's happened is students just have another layer of stuff going on. So you know what? I'm still probably going to have a bad time in math and not really understand what all I can do to get support services and academics. And so that'll be my role to figure it out, regardless if there's a pandemic happening, regardless if there's remote learning happening. What we have done in terms of our services is increase the amount of text messaging that we do. We utilize Google Voice as a platform so that we can continue to interact with students. What we've heard is some students who, especially those who are in rural environments who may not have super strong Wi-Fi connections, may be able to get somewhere for Wi-Fi, not carry on an entire conversation, but can certainly text back and forth, which allows for them to get quicker answers. But we still have the same hours and we still are providing the same services regardless. I do think that it's important to know that not meeting in person has certainly not hindered the rest of the institution from functioning. And we feel the same way here. So we've utilized Zoom. You can still call us on the phone. There are many ways for us to connect. But here in our offices, I think we've just probably expanded our knowledge of resources in different areas. I tell people all the time, what you need on a Friday morning may not be what you need on a Tuesday afternoon. And so we're just staying as adaptable and flexible as possible, which frankly has always been a hallmark of our office. And so truly at the core of what we do, very little has changed.
Wonderful. Well, thank you.
Yeah.
So could you tell us a little bit more information about the financial and academic assistance you could point students towards?
Yeah, absolutely. So we're really blessed to have really strong partnerships with our Office of Student Financial Aid, as well as the Division of Academic Enhancement. And so for students right now who are navigating, determining maybe what their schedule is, or really just looking to tutoring services or financial assistance, what we try to do is point them to things that they are eligible for. So finding out what students are eligible for and then letting them seek those services out themselves to find out if it's a right fit for them. And then if it's not, we tell those students, come on back and let's keep looking. I know that can be frustrating, but the reality is we're not here to drive the car for you, but we are here to sort of pave and fill in the potholes along the way so that you can know what's step one, what's step two in terms of finances and academics. To get specific, when we're talking about finances, there's several emergency funds that are available to students. The first that comes to mind, obviously, is the emergency fund that's run by the Office of the Vice President of Student Affairs. That's for all students at UGA to apply for. It's a one-time grant, so you don't have to pay it back, but you can only receive it one time. And we encourage students to apply and really think about what's the full amount that I need. So maybe I think I really only need $75, but the reality is that probably in 2 weeks, I'm going to need another $75. And so really thinking about the comprehensive ask that they need to make. Not to say that we can get them granted that money, because there's certainly different restrictions to that, but certainly helping a student understand that they have a voice to ask for it. The second thing I'll say in terms of academics, I'll sort of put that in twofold. One, I think the Division of Academic Enhancement has some incredible online modules that allow for you to learn how to do distance from afar. And I know that y'all have talked to, I think there's some town hall pieces with the DAE, but also helping students feel empowered to speak with their faculty during this time. There's a lot of communication between student care and outreach and faculty all the time when students maybe aren't engaging on digital platforms as they had once before. Maybe you felt like you could really be yourself. I think there was a Red and Black article about this. I feel like I can really be myself and speak my mind in that class in SPIA that's about women's rights. But when I'm at home, that's not something I feel comfortable with. And so working with students to understand how they can talk to their faculty about that. Or maybe we get in the middle of being the liaison between the faculty and the student. So maybe a student has circumstances that have been exacerbated. I think about those students who've had to return home to situations that aren't healthy for whatever reason. And maybe they don't want to share their business on blast, right? Like I think we all get keeping privacy private. But what we can do is help inform the consideration of a faculty member so that they can decide what they can do to support a student without having to share all of their business.
Great. Well, that all sounds wonderful. So how could a student or parent go about reporting a concern to student care and outreach?
Yeah, so these are something we really pride ourselves on, are having multiple channels. So we, of course, what I would say right now is that we have a general email. It's sco@uga.edu that's checked during business hours from 8 to 5. And so those emails are addressed pretty quickly. The other thing, of course, is that you can call us. Different from before, right now, you certainly can't walk on into the office, but we will be seeing students in person if that's going to be the best fit. We just won't be in our offices. We'll be identifying occupying spaces and following the CDC, USG guidelines in terms of meeting. But what I will tell people, and we do get a lot of reports from students through this, is at sco.uga.edu on our website, we have a button that says report a concern. That's a place for anyone, faculty, students, staff, parents, community members, people who have the internet, can go in there and click through and report a concern for themselves or a student. What I'll tell you about that is when you see the word concern, I think there's all of a sudden this need to have this like hyper intense issue and you're falling to pieces and whatever that looks like. But the reality is that the moment that you tell us you've got something going on, let's get together and try to do something proactively about it. Let's not wait till you get into crisis. That's not to say that if you are in a situation where you're falling apart, same button, same response, and same response time. I will tell you though, and you'll get the message on there, if someone is really in crisis and you're worried about their actual safety, you still want to call 911. That report of concern button is not going to be the thing that happens. But it's on the internet and it's 24/7. And I know that all college students do things from 7 a.m. to 9 a.m., right? Isn't that right? No. So probably we're going to need things to be available to them at 11:30 at night when it comes to mind that they need to reach out and get help. And so that's a really great way to reach us.
Awesome. So let's say a student has a concern having to do with the health and safety of returning to campus. And what would they do with that if it involved being required to attend in-person classes?
Yeah, so I think we need to think about the idea of being required. You're not really required to do anything, right? I mean, we have a lot of students reaching out right now who are saying, what is the deal? Like, we're going to be in person. So I'll give you kind of the company line, but then unpack that a little bit. The University of Georgia is going online. It's not going online. We're going to be in person beginning on August 20th for our first day of class. If that's not something that you want to pursue, then let's talk about the options you've got. If you come to our office and we chat through it, the first thing I'd probably tell you is, hey, maybe you touch base with the faculty who are instructing the classes you're enrolled in the fall and say, these are my circumstances. Maybe you have someone at home that you feel like is going to be at risk if you're in these classes in person. Talk to your faculty. See if that's an arrangement that they're willing to meet with you, or if there's any sort of agreement you can come to about continuing to be in that class. Now, there may not be, but I think that that's good to learn how to have a conversation with faculty. Frankly, that's kind of just a life skill to pick up later on. There may also be students, though, that do have a disability that's going to make them high risk. And so I would really encourage those students to connect with our Disability Resource Center and get registered so that they can go through the appropriate channels to get academic accommodations that are appropriate for their needs. And then finally, our registrar's office has really great PDFs of all the classes that are offered online for fall 2020. Go and look and see if any meet your educational needs for this semester. If in-class learning isn't what you want to do this semester, touch base with your instructor to see if they're still on par with what you need in your degree works, and figure that out. And then finally, if you don't feel comfortable coming this semester and you feel like you need to take a semester off, I would definitely encourage you to connect with our office first so we can really make sure you've looked at all of your options and so that you've connected with the appropriate offices before you make that type of decision.
Sounds good. So where's the best place for students to stay updated and learn more about the services that you offer?
Yeah, so the University of Georgia, and I don't have this address off the top of my head, but the University of Georgia has a website that's being updated very regularly about assistance for students, parents, faculty, staff, concerning coronavirus and the different things the university is doing to protect students, but also to keep the same high caliber learning environment that the University of Georgia is known for. There are different modules that you can click on for students to take a portal, parents to take a portal. And so I would encourage people to visit that. It's being updated by the minute. We're certainly driving people from our webpage there. And I'd also say that that's the great thing about student care and outreach. We're never going to push away a phone call. And so if you feel like you're not really sure about something, I really encourage you to report a concern with that concern button or contact us so that we can try to unpack that for you. Or maybe if there's not an FAQ listed, try to get you the answer to that question as soon as we can. I think my job, which I love, is either I have to know everything, but more importantly, I got to know the people that know everything. And so if I don't know the answer to the question, it's my responsibility to figure out who can give you the answer to the question.
Awesome. So what kind of advice would you give to incoming students during this time?
So I'd probably give the same advice that I give to everybody. The first thing is there's a reason you have an email address, so check it. I don't know why students are so averse to checking their email, but it seems like it's such a burden, even though I've noticed that it's just on everybody's phone in their pocket. So take advantage of that phone and check your email. That's where you're going to receive a lot of up-to-date communication. That's where you're in the know on things. And so really check your email every day so that if anything occurs, or if you're reaching out to faculty to try to figure out how you can feel best supported, or staff in other offices, they're going to come to you through your UGA email. So keep checking that. The next thing is, and this is what I find, as the University of Georgia becomes more selective and our students become so incredibly well-rounded and intelligent and high achieving, nobody wants to raise their hand and ask for help. It becomes very difficult for people to understand that asking for help is a wise move and not one of weakness. And so what I also say is, find your person on campus, and that may take some time. And if you don't know, find student care and outreach. Let us be your person until you develop deeper relationships, or maybe you develop deep relationships with us. But don't be afraid to ask for help on day one as opposed to day 100. Because I'll tell you what, on the first semester of college, or for whomever, whatever it looks like as we re-enter into this different time, I can do a lot more for you in late August and early September than perhaps I can do for you in December. And the idea, again, don't wait until you're falling apart. Wait until you kind of got something a little bit loose, and we'll try to figure out how to make it better.
Awesome. Thank you.
Yeah.
And so on the topic of food pantries on campus, where could we go about finding those? And then this is a two-part question, I guess, but what do we do if we notice a friend needs some help?
Yeah, those are both really good questions. So our main food pantry, so the UGA food pantry, is run by UGA Panhellenic and is located on the first floor of Tate. We've kept that open the entire time the university has been closed, and students have been able to access that. Now, even with Tate closed, the Tate Student Center closed, students can come at any point in time during normal business hours, 8 to 5, and there's a phone number on a sign on the door on the first floor of Tate that you can call, and the Greek Life office will get you into the food pantry to get you access to whatever you need. There are some other food pantries that exist, and specifically here, I know we're talking about food, but they may not be running at full capacity during the quarantine and during this time. I will say we're still staying very connected to the Northeast Georgia Food Bank, which is by far the most robust food bank in the Athens area. And if students need transportation or figuring out how to get there, it is on the Athens Best Line. And so we can help students navigate that process as they try to get food. So that's with food pantries. I also would just say Bulldog Basics, which is an incredible resource, has continued to also be open. Bulldog Basics, of course, being our hygiene pantry that's run by the College of Family and Consumer Sciences. I would encourage people to visit their website to see how you can request goods from them as well. So what do you do if you see a friend that's in need? So first and foremost, I think lost is the art of communicating one-on-one. If you see a friend that's in need, I think there's such value and power in looking at a friend and saying, hey, are you okay? Sometimes students or people, I should say, are averse to discussing their private issues, but sometimes just hearing someone say, how are you? The floodgates open up and all of a sudden someone feels like they want to be heard, which is great. But let's say maybe what usually ends up happening is you ask, they say they're okay, but you can just feel that they're not. Or maybe you notice a change in someone's behavior. Maybe you notice that someone's just really not coping well, or you know that they've had a life event that's occurred and you're just worried it's affecting them because something seems off. Again, I would encourage you to come to our office, share a little bit about what's going on if you don't feel like the person in your life will be receptive to you, and let us figure out, maybe we've had communication with that student before. And so for all you know, and we won't be able to tell you, that's somebody I've met with 10 times and I have no problem reaching out going, hey, I just want you to know, but your friend's concerned about you. Sometimes people get worried about friends being told that they've tattled on them. And I think it's on really our college students to destigmatize the idea of also asking for help for our friends. So yeah, let's say your friend gets mad that you ask for help for them. Would you rather live with your friend being mad at you or something going worse or getting worse, and you never asked for help because you were just scared of someone getting mad at you? We can consult on all of that and really talk through kind of the level of gravity based on what you know. And I find that often with social media, we know so much about students and what they're going through. But I wouldn't hesitate to ask someone what's going on, nor would I hesitate to come to our office for a consultation or just for us to provide support to your friend. And then finally, the option is, as you're talking to that friend, if they feel like they're open to speak to someone at the university, if it's something that needs to go to their counseling and psychiatric services, you can by all means get them connected there. But maybe email us together and say, hey, or call us in the middle of the day and say, someone available for us to walk in and meet? My friend's really having a tough time. And then we'll be able to set that up. I think it's pretty cool when peers refer peers to come in to see other people, because again, we talk about people as university administrators, but at the end of the day, the only thing I get a paycheck for is helping students. And so I wouldn't be doing this job if I didn't want to keep doing that every day.
Wonderful. Well, that's some wonderful advice. Thank you.
Yeah.
And so to end on a fun note, what are you most looking forward to in this upcoming fall?
Gosh, that's hard to say. As sad as it sounds, I think I'm excited I'm back in the office now. I really enjoy the people that I work with, but I'm really excited to see some of the faces that I didn't get to see in March when they left. I'm still going to be hopeful that we're going to have commencement as it's planned now. There were so many of our graduating seniors that I didn't get a chance to say goodbye to. And even though I may have to do it with a mask waving from afar, I'm hopeful that I get to see them. But I think really, all in all, I'm just ready for people to come back and form community, even though it may look a little differently moving forward, so that we can keep on realizing how lucky we are to be at the University of Georgia.
Wonderful. Well, Dr. Smith, thank you so much for taking the time to speak with us today. And we invite all of our parents and students to visit you at sco.uga.edu to learn more about student care and outreach. We within SGA are incredibly thankful for the dedication that you, Dr. Seagreaves, and all of OSC does for our students. And I'd also like to thank all of our guests who attended and spoke about how the university will be adapting this fall. If you have any additional questions, please do not hesitate to visit the sites on the screen, DM us on social media, or even email your senator. Check out our next town hall this upcoming week on student experience, including the new engagement, leadership, and service office, as well as Greek life and rec sports. Have a wonderful week, and as always, go Dogs.